For us, the essential feature of the autistic disorders under the umbrella are three. And it helps us when we're trying to make the diagnosis, but it helps families understand why autism applies to the child in question. And the first and most important is the child has, and this is the official word, impairments, but has difficulties with reciprocal social interactions. And we're going to look at what that is. But at the same time, the child has to have impairments, sort of the medical word, but difficulties with verbal and nonverbal language or communication skills. And then finally, and because of the first two, the child has to show a pattern of restricted or interests or behaviors. So instead of socially interacting and socially communicating with others, the child says, I'm going to substantially separate myself and be interested over here in the corner with lining up my trucks, or stacking blocks and not being interested with the other kids in the play center. And so these three components have to be fulfilled. It's a criterion in order to qualify for the autistic disorder, the pervasive developmental disorder not otherwise specified, and in a different way, the Asperger's disorder. Whether it's any of those three terms or all of those three terms, the core central features of autism are, I think, best to review. And it hinges on social interaction. So for the restricted ability to socially interact, the first component of the autistic diagnosis, children show us difficulties or struggles with nonverbal behaviors to regulate social exchange. They can do that with eye-to-eyes gaze. They can do that with social expressions. They can do that with body postures. They could do it with gestures. When parents raise concerns about this difficulty, those concerns, when they're raised, that's very rare. Most parents and children, like most children learn to walk, most children learn to this natural back and forth of human communication. And if parents do raise these concerns, we teach here at Erikson and we teach at the University of Chicago, that those concerns are serious red flags, that these kids have to be highlighted and watched closely. First birthday parties are another great time to learn and watch about this typical social emotional development. And if you think about first birthday parties, what's great about a first birthday party? It's for me. Nobody else is having my first birthday party, right? It's a party for me. I'm the center of attention. And it's a time for me to share this pleasure. All of these people have trying to organize some pleasure for me to share my pleasure about this party with others. So it's a great time to look at the level of social emotional communication. It's also a time to get a sense, and we talked about nonverbal communication, about how kids direct attention, how the cake and the candles, that's the main act. And there are not instructions for a birthday party. There's no cue cards. Someone's going to get a cue card and flash me 5 minutes left. So that helps me. But at my first birthday party, there were no cue cards to say, stand here, smile now, you know. So kids watch and pick up from other people's nonverbal communication the instructions for a birthday party. How does it work? What's the program? And that the cake and the candles, this is the main act. And it's also a time for, it's a touch point for this shared experience for the family. And some very smart researchers who had done longitudinal work with kids with autism asked parents to bring in the child's first birthday video. And they also asked parents to bring in the child's typically developing children's first birthday videos. And then they mixed them all up, and they had trained people watch the videos to see if they could get a sense of who, from these first birthday videos, were going to struggle and develop difficulties called autistic spectrum disorders or not. And 9 times out of 10, at the first birthday party, trained people could look at the birthday interaction and say, this kid is going to go into the kid who's going to struggle pile, and this kid's going to not, based on the first birthday video interaction. Families whose kids struggle with autism, the cake's not interesting, the candle's not interesting. This whole event is a sideshow to my restricted interests, my restricted behaviors, which are separating me from the social communication and the language communication that's part of this rich event. So I thought to end, now that you've seen the definitions of autism, the umbrella and the terms that fit underneath the umbrella from autism, and how the core features of autism and our kids who are early identified with autism really hinge on that a social communication piece, a social interaction piece. We talk a little bit about how we at Erikson have hope for kids with the autistic diagnosis through early intervention. And the reason we need to do this is because parents have told us, not me personally, but have told pediatricians, that they suspect in their kids, or 50% of the parents whose kids later get diagnosed with autism suspect something before the first year. So parents know something's going on. But it's hard to get that translated into a system of care because they don't often tell the pediatrician or the nurse practitioner or the nurse in the office that they're concerned until 18 months. And then once they label that concern, they say a concern that I'm really worried about Johnny's eye contact, or I'm really worried about Johnny's language functioning. Most children don't come to a diagnosis until they're 3 or 4 years of age. And the early intervention data is very clear that the earlier we start services for kids, whether they're 2 or 3, the better they do in services. They have better outcomes, and the families as a whole do better too. And that's the work we do here at Erikson.